Thank you so much, Sue, for inviting me to come and speak to you about a topic that I believe should be a priority when thinking about staff and student wellbeing, and particularly within the current climate when we're considering the retention of midwives and the composition of the future workforce. So as Sue said, my name is Emily and I'm a senior lecturer in midwifery at Middlesex University. And I'm going to be talking to you about neurodivergence. Now, many of you may have heard this word, and some of you have a personal connection with neurodivergence. And the reality is that we must address it to ensure that we have a healthy and diverse workforce. The People Plan for 2020-2021 promoted a vision that placed a compassionate and inclusive culture at the centre of the NHS, and it highlighted that all NHS employees and employers are accountable for tackling bullying and harassment. However, the more recent NHS long-term workforce plan draws on evidence that demonstrates that staff with one or more protected characteristics are twice as likely to experience discrimination and bias. So to explain to you why I'm so passionate about raising my voice about neurodivergence, I want to give you a few key statistics. According to the research, about 1 in 5 people are neurodivergent, so that's approximately 20% of the population. But this figure is thought to be higher in healthcare workers because the medical field self-selects for many neurodivergent strengths, such as hyperfocus, curiosity, self-motivation, and an attention to detail. And really shockingly, a recent study has shown that around 1 in 2 employers report that they would not employ someone from at least one of the neuro minorities. And the greatest bias is towards people with autism, ADHD, and Tourette's. Women, people from the global majority, and the LGBTQ+ communities are chronically under and misdiagnosed. And that means that our students and staff working within the maternity services are really often unable to receive the support and the adjustments that they require. Now, I think a really interesting thing about neurodivergence is its innate intersectional characteristic. You can be neurodivergent regardless of your age, your race, your sex, your gender, or your religion. And so I think that the neurodivergent community, both within our workforce and the service users that we care for, needs better visibility and awareness so that we can make sustainable changes. But really, to understand why I'm dedicated to raising my voice, I need to give you a little bit of personal context. I'm autistic, as Sue said, and with this has come certain challenges, but I also feel that there are great strengths that have come along with this. I am constantly trying to navigate a world that can be very overwhelming, overstimulating, and quite confusing for me. And through discussions, I've realised that many of the things that might be taken for granted in your everyday life, so something as simple as an interaction as with a colleague, or answering an email, or talking to new people, or even meeting up with friends, these are all things that I will have thought about deeply and rehearsed many times in my head before actually undertaking them. And ultimately, that comes at a cost. And sometimes that's exhaustion, but sometimes in more severe cases, it can be burnout. So that you can begin to understand what it could be like to navigate working in a busy practice environment for a neurodivergent student or midwife, I want to share an animation with you. I will put an immediate disclaimer on this because there will be a very loud noise at the beginning. And I've done this in conferences before and I didn't give the trigger warning early enough. So I want to warn you, if you're wearing headphones or if you're noise sensitive, please be warned and remove them or turn the volume down on your device. I'm going to start it now, so please be warned.
I'll be handing over Mrs. Khan in Bay 3. She is Gravida 2, Para 1 with 1 previous cesarean section. She is 37 plus 2 today. Mrs. Khan came to triage at 5 p.m. today with some spotting and was admitted for observation. Observations are within normal parameters and there was no pain or abdominal palpation. She has had a CT check with a registrar and done as well. Jane. It's really busy on the ward today, and you haven't had a break in a quiet area for hours. Would you like some help?
Okay, so Nicolette and I actually created this animation as part of the RCM's Neurodiversity in the Workplace e-learning module. Please be aware that this animation does not represent every autistic or indeed every neurodivergent person's experience, but hopefully it can give you just a little bit of insight. This is also an example of the animations that we have used in the e-learning that we published on NSHE e-learning hub a couple of months ago, and I'll tell you a little bit more about that a bit later on. Now, the main issue that we encounter in the UK is trying to get a diagnosis. To give you a personal example, when I moved to the UK, I already had a historic diagnosis from France, but this was not accepted here. So I began the diagnosis gauntlet, and after being moved from service to service for 3 years, I decided to get a private diagnosis. And I concluded that diagnosis in the UK is a privilege and not a right, because it cost me £2,700 to finally be diagnosed. And as a side note, this is an experience reflected by many students and qualified midwives who recognise that they're struggling, but then they struggle to get a diagnosis and the correct support. So if you are a manager and you're listening to this, it's really important to note that self-diagnosis is perfectly acceptable. And with a letter from the doctor stating that you're seeking diagnosis and that you're on a waiting list, you can access support through Access to Work and meet with occupational health to have reasonable adjustments put in place. And students can also access support through services at their university, and they're entitled to support from the DSA. One of the ways that I wanted to use my voice was by being a role model for my students. And that has meant having to be quite vulnerable about my own experiences, which isn't always an easy thing to do, I would admit. But I observed really early on in my academic career that many of the midwifery students leaving the course in the first 2 months, and particularly upon starting their first NHS placement, were neurodivergent. And that was evidenced by their learning support forms. And this really concerned me because the individual student would leave due to a lack of reasonable adjustments, but also they would feel as if they'd failed. And it's also hugely impactful for the profession because we know that we need to work on retaining future midwives. And ultimately, they were quite simply falling through the cracks. And it's continued to be clear to me through the online forums that I take part in and the projects I've led and the people that I've spoken to that neurodivergent students and midwives want to feel as passionately about their jobs as they did when they started. But the reality is that many of them feel unseen and unheard, and they're encountering huge barriers to support in practice. And ultimately, that's leading to them questioning if they have a place in the NHS, and many are leaving, which I think is devastating on so many levels, both personal and professional. So it was really essential, with all of this in mind, for me to start tackling the societal taboo around neurodivergence and to build collaborative projects that ensured that the voices of our neurodivergent colleagues were heard. So some of the recent projects that I've led were the development of the RCM iLearn module on neurodiversity in the workplace, and that was released in March 2023. It's accessible to all RCM members. And this then led to leading a stakeholder group of neurodivergent students, midwives, and academics, and collaborating with the RCM to develop the Neurodivergence Acceptance Toolkit for midwifery education. And that was launched in March 2024 at the RCM conference, and it's been shared with higher education institutions and trusts across the UK. A more recent project, following funding from the Repair project, enabled me to work with neurodivergent students from across the UK And we developed a series of animated e-learn modules for any healthcare professional who might be working with and or assessing healthcare students. Now, this one is freely available on the NHSE e-learning hub, and I think it's a really useful tool for staff to explore during update sessions or during practice supervisor and practice assessor sessions or any other staff sessions on cultural awareness. If you are listening in and you're wondering what you can do to create a more inclusive working environment for your co-workers and the students that you work with, a really good place to start would be by completing these e-learning modules on the RCM iLearn and the NSHE e-learning platforms. Because I think listening to people's lived experiences and educating yourselves about the small adjustments that can be made would be a really good start to making a difference. It isn't really just about awareness because we really need to start to take action. So where are we now? I wanted to use my own lived experience to power discussions and implement concrete change. And over the past few years, numerous networking opportunities have led in turn to engaging conversations with midwifery leaders from all over the country. But the conversations that I've had have shown that although EDI policies are in place and certain trusts are leading specific initiatives, institutions are globally unsure about how to concretely support neurodivergent colleagues, and that ultimately leads to inaccessible and non-inclusive working environments, and people are leaving the workforce. In 2023, I joined the Capital Midwife Preceptorship Framework Update Task Force, and it aimed to review preceptorship guidance. And I was able to give perspective and review the guidance through a neurodiversity lens. And I really hoped that this would drive positive change within the preceptorship process and challenge NHS leaders to improve accessibility and inclusion. But I do think that there's still vital work that needs to be done in this area. And as I said earlier, I'm in multiple online forums and Facebook groups with neurodivergent midwives and students from across the country, and many are struggling and considering leaving their studies or the profession, or already have left. For example, students are not getting reasonable adjustments allocated to them for assessments because there's still the misunderstanding that this would give them an unfair advantage, or that they've been told that they wouldn't get extra time in practice. So if you're an educator working within an HEI, I highly recommend looking at the RCM's Neurodivergence Acceptance Toolkit to support you to improve accessibility for students from recruitment all the way through to reviewing your curriculums and your assessments. The argument about unfair advantage has the following counter arguments. Firstly, students are entitled to reasonable adjustments as per the Equality Act. And I also want you to consider that in hospital, in an emergency, you would not be alone and you would be able to count on the multidisciplinary team. So we need to take these things into consideration. Neurodivergent midwives are also struggling to get the appropriate support to be able to do jobs that they are passionate about and feel really driven to do. And if you're one of these midwives, please rest assured that there is ongoing work to improve working conditions. I spoke to leaders at the NMC just this week, and I know that among other priorities, they are beginning to examine the experiences of students with additional learning needs in practice. I'm also continuing to work really closely with the RCM to begin to develop guidance to support neurodivergent midwives in practice, because I have heard what midwives have to say, and a lot of the work that's been done so far has been focused on students. So I would like to say that we are now also aiming to work around midwives in practice. And I've also met with with many of the heads and directors of midwifery across the UK to raise awareness. So if you're a midwife and you're struggling in practice, I recommend that you reach out to your PMAs. Ensure that you've applied to access to work and that you've spoken to occupational health. The PMA network are huge allies for neurodivergent midwives, and I've spoken to many of them, and they are really incredibly keen to support you in practice. So I'm going to end by saying that this has been a grassroots movement from the ground up, but what I think is missing is tangible policy change and support from the top down. I think that neurodivergence is one of the major strands not being addressed when it comes to staff and student retention. I'd like to see more concrete policy and guideline changes made to ensure that people with protected characteristics can thrive in education, as well as within the NHS, whether they are working or accessing services. So thank you very much for listening. And of course, I'll welcome any questions at the end once we've heard from Nicolette.